Welcome to the first training module for Jackson Developmental Center and Jackson Children's Services COVID-19 Reopening Safety Plan. As this is the first training module in a series, this module will focus on safety. Safety first and safety always. Jackson has invested time and effort to create a reopening safety plan that complies with all mandatory safety standards. This reopening safety plan is compliant with all federal, state, and local standards, including all recommendations from the CDC, EPA, OSHA, New York State Department of Health, New York City Health Department, and the New York State Education Department. But no matter what Jackson can do as an agency, the most important part of any COVID-19 safety plan is you and me. It is the behavior of individuals that is the most important factor in stopping the spread of COVID-19. There are 4 key actions that every person can take at all times to help stop the spread of COVID-19. Number 1, if you are sick, stay home. Do not leave your house if you are not feeling well. Only go out for essential medical care or essential errands. Essential errands are going to the supermarket for food or going to the pharmacy for medicine. Practice physical distancing or social distancing. When you are out, stay at least 6 feet away from other people. 3, wear a face covering. You can be contagious with COVID-19 without having any symptoms. By wearing a face covering, you'll help to reduce the spread of COVID-19. And finally, number 4, and possibly the most important, practice healthy hand hygiene. Wash your hands. Wash your hands often. Wash your hands with soap and water. It's the preferred way of having COVID-free hands. If you cannot use soap and water and it's not practical, then use hand sanitizer to clean your hands. The hand sanitizer has to be at least 60% alcohol to be effective against COVID-19. Avoid touching your face with unwashed hands. And make sure to cover your cough or sneeze with your elbow or the sleeve in the crook of your arm. If we can practice these 4 key actions, we can be essential in stopping the spread of COVID. At all possible times, Jackson's staff and providers should practice social distancing. To do this, maintain a physical distance of at least 6 feet from all other persons. When there are guides or markings on the floor to evidence 6 feet of space, please pay attention and follow the guides or markings. When guides or markings are not available, please imagine a regular door lying flat out on the floor from top to bottom. That is typically 6 feet in height. If you picture yourself a doorway's distance from another person, then you are practicing social distancing. Please note that all of the safety standards and information that we are discussing in this module relate only to staff safety. There will be several other modules that will speak specifically to safety standards when providing in-person services or when children are back on site. But this module is talking about staff and staff safety. So to that end, when staff or contractors are on site at Jackson, we have taken the following steps to make sure that physical distancing can be practiced. At this time, Jackson will limit the total number of people allowed in one of its buildings at any given time. We will modify work and seating areas by rearranging these areas to make sure that social distances of at least 6 feet or more in all directions can be maintained by anyone sitting or working in those areas. We will limit the number of building entrances to only one entry point so that we can manage the flow of people entering the building. And we will post social distancing markers wherever possible using tape or signs so that we can mark off 6 feet of spacing in commonly used areas. Also, in commonly used areas that are big enough, Jackson will try to reduce bidirectional foot traffic by posting signs with arrows to define the direction of traffic flow to prevent people meeting in the middle. Jackson will also limit the amount of people allowed in tightly confined spaces to only one person at a time. And Jackson will mandate that any and all gatherings that will take place via teleconferencing or video conferencing. In the same vein, Jackson will limit the amount of on-site staff interactions that occur. There will be no going to another person's desk to get or exchange information. All staff contacts that can be transacted with a telephone call or an email will be. There will be no area for communal lunch. No staff member will be allowed to have a visitor on site. There will be one staff entrance and one staff exit. All of these measures are not intended to be harsh or punitive. We are trying to limit the number of people in a building and in particular areas of a building so that we can help prevent the spread of COVID and keep you safe while you're on one of our work sites. Also, to help promote physical distancing on site, Jackson will prohibit building access to any visitor who's a non-essential visitor to every extent possible. We're also going to limit access to the building to those persons who are related to us for business purposes, but who do not work on site. This, for example, would be our EI contractors. We will try not to admit you to the building if we can help you remotely. And if we do allow you to come into the building, you will have a limited amount of time and a limited location where you can be in the building. Again, this is not to be punitive or harsh. We are trying to limit the amount of people in the building and the amount of places where people go in the building so that we can keep everyone safe. And that means you too. Finally, Jackson will post signs throughout the buildings, all of its buildings, inside and out, that are consistent with the Department of Health COVID-19 signage so that we can keep people apprised of what our policies and procedures are for COVID-19 safety practices while they're in the building and before they enter the building. But no matter how hard we try, there will be times when social distancing cannot be maintained. So anytime you cannot maintain a safe social distance of 6 feet or more from another person, you must wear an appropriate face covering. And there are times when the safety or core function of an activity requires that you be closer than 6 feet. At those times also, you must wear an appropriate face covering. As a special education preschool, universal pre-K program, and early intervention center, Jackson is in the business of close encounters. You cannot stay 6 feet away when you are caring for a young child, providing services to a young child, keeping a child safe, or providing emergency care. The core function of what we do keeps us closer than 6 feet to the children we serve. It is for that reason that all Jackson direct care providers must wear an appropriate face covering at all times while they're providing services to children. If you are with children, you are wearing a mask. It is also true that all Jackson non-direct care staff must wear an appropriate face covering at all times when away from their desks or when in shared work areas. When non-direct care staff members are at their desk, they may remove their masks, as their desks will be positioned a safe distance from other workers. However, they must be prepared to immediately put on an appropriate face covering if someone unexpectedly comes within 6 feet of them. The following face coverings are considered appropriate face coverings for COVID-19. Cloth masks, which could be homemade sewn, quick cut, commercially made, or a bandana. They are appropriate face coverings. Surgical masks or N95 masks. All are considered appropriate according to all federal, state, and local standards. Jackson will provide for its employees masks for while they are at work at no cost to the employee, and will maintain an adequate supply of masks in the event an employee needs a replacement. While Jackson will be providing employees with masks, employees will be permitted to use any appropriate face covering or PPE that they provide for themselves, as long as it is appropriate and used correctly. In accordance with CDC guidelines, Jackson will be providing its employees with face coverings that are made of cloth, giving them an initial disbursement of 1 week's supply. Again, Jackson will have an adequate supply of face coverings in the event an employee needs a replacement mask. Finally, Jackson will continue to monitor the CDC, New York State Department of Health, and OSHA pages and guidelines to make sure that we remain current with all mask and PPE requirements. Jackson will not provide masks or PPE for contractors. Instead, Jackson will obtain specific written statements via email from all contractors that evidence the contractor's agreement to provide their own personal protective equipment. Jackson will not enter into a contract with or continue a contract with any provider who refuses to agree in writing to the provider's responsibility to have and use appropriate and compliant PPE for their service provision. Any employee or contractor who chooses to wear a face shield while providing services must be aware that face shields by themselves are not an appropriate face covering, as they do not protect your nose and mouth from droplets. If you are to wear a face shield, you must also wear a mask. In that way, your face covering will be appropriate. Masks with breathing valves cannot be worn by anyone at any time. The breathing valves only filter inhaled air. They do not filter exhaled breath, and therefore they are not appropriate face coverings. Now that we know what masks are appropriate face coverings, let's learn how to wear a mask. A mask must cover your nose and your mouth. The first thing you will need to do in order to put on a face mask is wash your hands. You must always wash or sanitize your hands before putting on your mask. Once your hands are clean, hold your mask by the ear loops or by the ties and inspect your mask to make sure that it is free of damage, that it is not soiled, and that it is not wet. Next, put your mask on by holding onto the ear loops or ties and placing the mask over your face and over your ears, or over your face and tying the ties to the back of your head. Adjust your mask to your face without leaving any gaps on the sides of your mask. Do not touch the front of your mask with your hands when you are putting it on or when you are adjusting it. Make sure that your mask covers from just under the bridge of your nose to under your chin. To accomplish this, when you are putting your mask on, hold the very top of the mask with your fingertips on the bridge of your nose, and then pull the very bottom of the mask over your chin, again with your fingertips. Please note that you should never wear your mask pulled down under your chin, pulled up onto your forehead or head, or hanging off from one of your ears. You should never touch the front of your mask when it's on your face, and you should never eat with your mask on or partially on. As soon as you put your mask on your face, the front of your mask is considered contaminated and should not be touched. In addition, your eyes, nose, and mouth should never come into contact with the front of your mask. And that is why you should never move your mask around your face to adjust it or to move it to any other position, because you run the risk of having your eyes, nose, or mouth come into contact with the front of your mask as you move it around. Again, please do not eat or drink with your mask on or partially on your face. Your mouth and your nose will not be safe or protected from the contaminated front of your mask if you do that. So while the picture with the ice cream is funny and no one would think of trying to eat food through a mask, a lot of people have thought it's safe practice to pull the mask down below their chin so that they could eat or drink something. Please do not do that. It is not a safe or healthy practice. Before you can remove your face mask, you must have clean hands. Wash your hands with soap and water or use an appropriate hand sanitizer. Then untie the strings from behind your head or stretch the ear loops off your ears. When you are removing your mask, only handle the ear loops or the mask ties. Do not touch the face of the mask. Once you have taken the ear loops off your ears or untied the strings of the mask off your head, immediately pull the mask forward and away from your face. Do not touch the front of your mask when you are doing this, and be very careful not to touch your eyes, your nose, or your mouth with any part of your mask while you are pulling it forward and off your face. If you are going to remove your face mask during the day and store it, for example, you are going to have your lunch, you will need to store it in a safe manner. In order to store a face mask that's been on your face and been used, you need to remove it properly and store it in a container that is easily ventilated. Some examples would be a paper bag or a plastic bag or plastic container that has had ventilation holes punched in. When you're storing your mask, make sure that you know which part of the mask is the front of the mask that has been on the outside and which part of the mask is the back of the mask that's been up against your mouth. For many masks, it will be very easy to tell the difference between the front and the back because they are physically different looking. But if it is hard to tell the difference between the front of your mask or the back of your mask, then make a marking on the mask itself or on the bag or container in which you are storing the mask to identify where you are storing the front of the mask. Make sure you store the mask in a way that when it is time to retrieve the mask to put it back on, you will not have to touch the front of the mask to get it out of its storage container. You may also store and reuse disposable masks. Like fabric masks, disposable masks may be stored in easily ventilated containers like paper bags or plastic bags and plastic containers that have ventilation holes punched in. You should hold the disposable mask by its corners and fold the front of the mask over onto itself so that you will not be able to touch the front of the mask when you are storing it or removing it from storage. If you are going to throw the mask out and not store it, make sure that you are throwing it out in a trash bin that is lined with plastic. If the trash bin is close, you may hold the mask by the ear loops or the ties and put it into the trash bin. If the trash bin is not close to you, then fold the front of the mask over onto itself and carry the mask to the trash, touching only the back of the mask. When you are ready to put your face mask back on and reuse it, you must first wash your hands or sanitize your hands before you can remove your face mask from its storage container. Pull the mask out of the storage container by holding onto the ear loops or the ties only. Make sure that you do not touch the front of the mask when you are removing it from storage. Once you have removed it safely from its storage container, proceed to put your mask on your face by following the guidelines of how to put on a face mask. So when should you wash your hands or sanitize your hands when you are wearing a mask? The answer is all the time. When you are wearing a mask, you must wash or sanitize your hands before you put the mask on, before you take the mask off, after you take the mask off and store it, after you take the mask off and dispose of it, before you take the mask out of its storage container, and after you accidentally touch the front of your mask while you are wearing it. Proper hand hygiene is essential to safe mask wearing. Do not leave your mask lying around your work area, lying on your desk. Do not store it in a pocket. Do not store it in your purse, not even in a purse that was made to store masks. Your pocket and your purse are not ventilated enough. Your desk and your work area is an exposed area. Do not hang your mask off your wrist while you're not using it, and do not walk around carrying it folded in your hands. Your mask is either on your face or properly stored in its storage container. Do not use or reuse a mask if it is wet, soiled, or torn. Also, change your mask if you have been in contact with someone who has shown COVID-19 symptoms or any symptom of illness. If you've cared for someone who has not felt well, change your mask. Finally, never share masks with one another. Everyone should use their own masks at all times. When using cloth masks, they should be washed daily. You can include your mask with your regular laundry and use regular laundry detergent to wash your mask. Use the warmest appropriate water in washing to clean your face mask. You can also put your cloth face mask in a dryer using the highest heat setting possible and leave it in the dryer until it is completely dry. You can also clean your cloth face mask by hand washing it. Use a bleach solution with the concentration that is listed on this slide. Make sure your bleach is intended for disinfection and is not expired. Soak the face covering in the bleach solution for 5 minutes, then rinse thoroughly with cool or room temperature water. You can air dry your face mask by laying it flat and make sure it is completely dry before you use it again. If possible, you can place the cloth face covering in direct sunlight for drying. Again, cloth face masks should be washed daily, but they should also be changed if during the day they become soiled, wet, or torn. So while you and I must wear a face mask, not everyone has to wear one. Who should not use a face covering? Children under the age of 2, anyone who has trouble breathing, anyone who is not conscious, and anyone who is incapacitated or otherwise unable to remove the mask without assistance. All children receiving in-person early intervention services or evaluations at home do not need to wear a mask. Also, all children in their preschool or UPK building or their preschool or UPK playground, and all early intervention children in their classroom, building, or playground area do not need to wear a mask. We've talked about social distancing and we've discussed the wearing of masks. I now want to talk about the third leg of the perfect trifecta for stopping the spread of COVID-19, and that is proper hand hygiene. To stop the spread of COVID-19 and to stay safe, all people must learn and practice proper hand hygiene. This is either washing your hands with soap and water or using hand sanitizer that is at least 60% alcohol. As you may know, there is a right way and a wrong way to wash your hands. To wash your hands correctly, first turn the water on and wet your hands. Then lather soap on your hands for at least 20 seconds. 20 seconds is the length of time it would take you to sing nice and slowly the ABC song. Make sure when you're lathering up your hands that all parts of your hands are soaped up, including and most importantly, your fingertips. After a minimum of 20 seconds of lathering, rinse the soap from your hands with warm water. Take a paper towel before you turn the water off and dry your hands. Then use the paper towel to turn the water faucet off. Do not touch the water faucet with your now clean, bare hands. Use the same paper towel to open any door to the washing area. Do not touch a doorknob or door frame with your now clean, bare hands. Once you are out of the bathroom, you may throw out the paper towel in a lined trash bin. So now that you know why you should wash your hands and how you should wash your hands, the question is when you should wash or sanitize your hands. And the answer is all the time. Wash or sanitize your hands upon arrival, between different activities, before and after providing routine care for a child who needs assistance, after blowing your nose, coughing, or sneezing, after using the restroom, before eating, after eating, before departure, and any time your hands are soiled. When your hands are visibly soiled, they must be washed with soap and water and not with hand sanitizer. Visibly soiled hands will not be made clean with just the use of hand sanitizer. That is why it's critically important in all the areas that you provide care and instruction and therapy to a child that you have access to a sink, soap, and paper towel for hand washing. Jackson has adopted a cleaning framework that is based on and meets all of the mandates and recommendations of the CDC and New York State Health Department. Anyone can adopt this cleaning framework personally or professionally to make sure that your cleaning is COVID safe. The cleaning framework involves normal and routine cleaning with soap and water first, and then disinfection using disinfectants that are EPA approved for COVID-19. This normal routine cleaning at Jackson will occur on a daily basis. Every evening when the staff has left the building, all parts of the building that are in use will be cleaned first with soap and water and then disinfected using disinfectants that are EPA approved for COVID. The second part of the framework includes frequent cleaning and disinfection of high-risk areas used by many individuals. This would include the restrooms. Thus, several times a day at a minimum, and more frequently if there's a need, Jackson will clean and disinfect high-risk areas. The cleaning times will be focused on the activity level and the activity locations within the building. But at a minimum, frequent cleaning and disinfection of high-risk areas will occur several times a day in the Jackson buildings. Finally, the cleaning framework includes frequent disinfection of surfaces and objects that are touched by multiple people. These surfaces and objects include tables, doorknobs, light switches, countertops, handles, copy machine, time clock, fax machine. This frequent disinfection of surfaces and objects will occur several times a day at a minimum, and more frequently should a need arise. In addition, the cleaning will be focused on the activity level and activity locations in the building. For frequently touched electronic devices that may degrade over time with continuous cleaning protocols, Jackson will provide hand sanitizer stations, alcohol wipes, and/or gloves on or around these devices to protect staff in their use. Jackson will also provide staff members with appropriate cleaning and disinfection supplies so that they can clean shared and frequently touched surfaces that are in their offices, classrooms, and therapy areas. Jackson will implement a strict clean desk policy that allows for only essential items to be on the desktop and all non-essential items to be stored in cabinets or drawers. This would mean that only a computer and telephone would be left on the desk when the staff member leaves for the day. And this would allow the maintenance staff the ability to thoroughly clean and disinfect the desktop and work area. Finally, Jackson will keep cleaning logs according to the CDC and New York State Department of Health protocols. These logs will document the date, time, and scope of all cleaning efforts. Jackson Developmental Center and Jackson Children's Services have implemented COVID-19 communication plans that facilitate open lines of communication for staff, providers, and families. These communication plans include the dissemination of instructions, training, and relevant COVID-19 information and resources through emails, text and call lists, and through its website. Jackson has also appointed COVID site safety monitors. Department supervisors and department heads will act as the COVID site safety monitor for their discipline. Finally, Jackson has also appointed COVID program-wide contacts. For Jackson Developmental Center and the preschool, Irene Fernandez Gomez will be the COVID program contact. For Jackson Children's Services, Tracy Meyer, the program director and compliance officer, will act as the program contact for COVID. Jackson has also implemented a process of daily health screenings. All Jackson staff and providers are required to complete a daily health screening before coming to work on a Jackson location or providing in-person services. The daily health screening will be completed remotely by staff using a questionnaire format. The health screening questionnaire is based on the CDC and the New York State Department of Health criteria and will be kept current as the CDC and New York State Department of Health guidelines change, so that every staff screening will be appropriate for the time in which it is given. Jackson's current health screening questionnaire covers 4 main topics. Anyone who's coming into work to work on site or to provide in-person services must be able to attest to the following information. They must be able to say that they are feeling well and that they currently do not have, nor have they had at any point during the last 24 hours, any COVID-19 symptoms. They must also be able to state that they have not been exposed to COVID-19 in the last 14 days. Additionally, they have to be able to state that they have not traveled outside of the country, on an airplane, or outside of the tri-state area within the last 14 days. And lastly, they must be able to state that their temperature is below 100 degrees Fahrenheit and that they do not have a fever. In order to take the Jackson Health screening, you will need to know what the symptoms of COVID-19 are. Jackson will follow the guidance from the CDC in their definition of COVID-19 symptoms. Currently, the CDC defines COVID-19 symptoms as fever or feeling feverish with chills and sweating, a new cough, difficulty breathing, muscle or body aches, a new loss of taste or smell, a sore throat, or vomiting or diarrhea. The CDC wants people to focus on new symptoms, so not a cough that you've always had that relates to seasonal allergies, but something new and something different. The most important thing that a staff member can do is, if they are feeling sick, to stay home. In addition to the health screening questionnaire, which will be done remotely, Jackson may be required to conduct temperature checks of staff, providers, or contractors before they enter the building or before they perform services. Jackson will not record any specific temperature data of any individual, but will maintain records that confirm that the individual was screened and the results of the screening, whether or not the person was cleared or not cleared. Any staff member or provider who screens positive for or exhibits symptoms of COVID-19 during a daily screening will not be allowed in the building or will not be allowed to provide services until that staff member or provider is 24 hours symptom-free. Many people have asked, what if I get headaches and I have a headache, or I'm sick to my stomach in the morning and I don't think it's COVID, but I have a symptom? You will not pass the screening for that morning if you have a COVID symptom. But if it is not COVID and you go 24 hours and become symptom free, then you will pass the screening and come back to work, so that non-COVID illnesses will not preclude you from coming into the building or working for long periods of time. You will be able to work and enter the building if you are symptom free for 24 hours. If the symptoms arise once the staff member or provider has already been in the building or has already started providing services, that staff member or provider will be sent home or will be asked to stop providing services and go home. Anyone who screens positively will be instructed to contact their healthcare provider for assessment and testing. Staff members will not be allowed into the building without performing the health screening questionnaire. And EI providers who provide in-person services without first performing a remote health screening before providing the services on any given day will not be reimbursed for the services on that day. If you receive test results that are positive for COVID-19, you must notify Jackson immediately. If a parent or family member tells you that a child or a person who has been on site or in the home during an in-person visit has tested positive for COVID-19, you must also notify Jackson immediately. When Jackson becomes aware of someone with positive test results for COVID-19, Jackson will immediately notify the New York City Health Department and all persons who have had close and proximate contact. They will notify those persons with close and proximate contact that they may have been exposed, but Jackson will not reveal the name of the person who tested positive. According to the CDC and New York State Department of Health, close and proximate contact is within 6 feet, which means less than 6 feet away, and for at least 10 minutes. Jackson will immediately notify the New York City Health Department of any positive test results for COVID-19 by emailing the New York City Test and Trace Corps. In addition, Jackson will also provide to the New York City Test and Trace Corps the name and contact information for all close and proximate contacts. In this way, the New York City Test and Trace Corps can follow up with anyone who's had potential exposure to COVID-19. If you are concerned that you were exposed but you have not been contacted by the New York City Test and Trace Corps, you can speak with your healthcare provider to discuss testing, or you can visit NewYorkCityHealthAndHospitals.org/test-and-trace/testing. COVID-19 tests in New York City are free, safe, easy, and available at over 100 locations. Go to newyorkcity.gov/COVID test to find a testing site near you. Returning to work. If you test positive for COVID-19, whether you have symptoms or not, you may return to work after you complete at least 10 days of isolation, either from the onset of symptoms of COVID or 10 days of isolation after the first positive test result if you never get symptoms. So if you have symptoms and you test positive, you have to isolate for 10 days from the onset of symptoms. If you do not have symptoms and you test positive, you have to isolate for 10 days from the positive test result. If you do not have symptoms and then you test positive and then later you develop symptoms, you need to isolate 10 days from the first sign of COVID symptoms. So if you have a positive result on a COVID test or positive for symptoms, your isolation period is 10 days. That's positive 10. If you have had close or proximate contact with a person who tested positive for COVID-19 and you yourself are experiencing COVID-19 related symptoms, you may return to work upon completing at least 10 days of isolation from the onset of your symptoms. This is a positive 10 situation. You've had close contact with someone who's positive, and you yourself are positive for symptoms. You have to wait 10 days from the onset of your symptoms in isolation before you return to work. Remember that close contact is less than 6 feet away from an infected person for at least 10 minutes, and close contact also starts from 48 hours before the illness onset and until the time the person was isolated. If you have had close or proximate contact with a person who's had a confirmed case of COVID-19 and you yourself are not experiencing COVID-19 symptoms, you may return to work upon a 14-day self-quarantine or isolation period. It is not 10 days, it is 14 days. Because you have no symptoms yet, and because it can take up to 14 days after exposure for symptoms to develop, you must isolate for 14 days instead of 10. Since we are fearful that you might still have COVID and get symptoms, your isolation period is 14 days. You may return to work after you have waited the appropriate amount of time in isolation or self-quarantine. Or if you do get a COVID-19 test result that proves that you're negative, you can share that test result and you can return to work sooner than the isolation periods. In addition, when you are self-quarantining or in isolation, any staff member or provider who is feeling well enough may work remotely if their job duties allow for it and upon supervisor approval and clearance. So if you're in isolation and you feel fine, you may be able to provide services remotely or do your work remotely and not lose out on that time at work. So speak with your supervisor or program supervisor to get clearance and approval. If you have spent the required number of days in self-quarantine but still continue to have COVID-19 symptoms, you may not return to work. You may only return to work when you are 100% symptom-free. If the parent or guardian or any member of the same household as the child is exhibiting signs of COVID-19 or has tested positive for the virus, this child cannot attend in-person school programming, nor can this child receive in-person, in-home services. If this child is on site when the notice is given, the child will be isolated and removed from the program. This is a situation in which the child is considered a close contact. The family member is sick or tested positive, and the child has no symptoms but is a close contact. The child must quarantine for 14 days, and the child cannot return to program or start in-person services until 14 days from the notice of the symptoms or positive testing of the family member has come to you. We're fearful that the child may be getting sick. This child must quarantine for 14 days in this scenario as a close contact. If a parent, guardian, or any member of the same household as the child is being quarantined as a precautionary measure, in that they do not have symptoms or a positive test result, but they may have been exposed, and so they are quarantining as a precautionary measure. The child may return to a center-based program during the duration of the family member's quarantine, because this child is considered a contact of a contact. But this child cannot receive in-person services to be provided in the home and must switch to teletherapy until all quarantine periods for all family members residing in that household are completed. If in this scenario, the child or their household member becomes symptomatic for COVID-19 while in this precautionary quarantine time period, or test positive for COVID-19 in this precautionary quarantine, it makes this scenario a positive 10 situation in that the child must quarantine and may not return to school or attend program or receive in-person services until after 10 days of isolation from the onset of symptoms or 10 days of isolation after the first positive test if they remain asymptomatic. In closing, there's a lot of information shared in this training module, and I encourage you to look it over and listen to it and read it and digest it more than one time so you will come to know the safety policies, procedures, and practices that you can participate in to be safe and keep others safe. These are unprecedented times, and Jackson promises to do their part to create a safe and clean workplace and to provide information and training to all staff, providers, and contractors. If you ever have a question or concern, please reach out. We are here for you. Included on this slide are my personal contact information. I am committed to remaining up to date with all information from all authorities, federal, state, and local, and want to be a resource to help make sure that Jackson staff and providers and Jackson children and families remain safe and thrive in these times. Remember, we are in this together. I have made promises to you on behalf of Jackson and personally, but you too have promises to keep, and not just for the times that you are working for Jackson. Your promises, like mine, are for all times. Promise to practice social distancing, to wash your hands or use alcohol-based hand sanitizer frequently, to wear appropriate face coverings that cover your mouth and nose, to avoid touching your eyes, nose, and mouth at all costs, to stay home when you're sick, and to clean and disinfect frequently touched objects and surfaces at work and at home, and to think before you touch. Ask yourself, do I need to touch this? And if the answer is no, keep your hands to yourself. To stop the spread of COVID-19, it all begins and ends with you. Thank you very much for participating in Jackson's COVID-19 Reopening Safety Plan, Module 1, Safety First and Always.